The other option we have for scar management is what's called Embrace Scar Therapy. Much like biocorneum, Embrace utilizes silicone technology, but it's in the form of a sheet instead of a gel. We use silicone on scars because it's been proven to help improve the scar quality, increase the healing time, decrease the redness, and flatten the scar to make it nice and smooth. So we'll use Embrace in areas that are usually a flat, straight line, or areas that have a lot of tension, because Embrace is used to take tension away from a scar. If scars are under a lot of tension, when they heal, they can pull apart, creating a thickened scar or a widened scar. So in order to avoid that, we use these Embrace silicone scar sheets. They come in 3 different sizes, and they can be worn for 10 days at a time. You will clean the area, apply, which I will show you shortly, and leave on for 10 days. After 10 days, you can remove the product. You can leave the incision open for up to 24 hours before applying the next one, or you can simply remove one and apply one right after one another. We usually recommend patients wear these for 2 to 3 months after surgery. And now I'm going to show you how to use this. Okay, so to use Embrace, first you have to pick the appropriate size. So our model here, we're using an old scar of hers on the leg. We'll assume that this is a surgical scar. And the largest size is what we're going to use for her today. So the Embrace, when it comes out of the package, looks like this. It's kind of sealed shut. So first thing you do is you want to forcefully open this and go back and forth several times. Really kind of get that cardboard to loosen up. Then, if it's especially on the longer pieces, you want to take this back and forth on the right and left just to get it to move a little bit so it's not as stiff. Once you've done that, you ensure the area is clean and dry. Bend back. There is a center line that when you fold this back on itself will give you an idea where the center of the Embrace is going to lay. You want to line that scar up essentially on the center of that black line. So when I fold this back on itself and I go to lay it down, I can line up that black line essentially with the center of that incision. So I'm going to center it, press down very firm, and we're going to go in 2 directions. We're going to go up and down, and we're going to go back and forth, and we're going to do this several times over the course of about a minute. I'm having the patient lay down because you do have to do a fair amount of pressure, and it's easier to push against the patient if they're laying down rather than standing. So just back and forth, back and forth. We want to make sure all these edges stick down. And then at the end, I just hold firm pressure for the last couple of seconds. And again, especially if it's the patient's first time, it's always a good idea to apply this for them, and then they can start doing it at home. But if you ever have any questions or concerns, or it's an area that's hard to reach, you can always come to the office and we can put it on for you. So after a minute has passed, you're going to pull each of these tabs. One on the front, one on the bottom, and peel this back. And now you will see this sheet has been laid down. None of the edges are peeling. Everything is nice and flat. This, you may get a little bubbling underneath here. That is okay, so long as the edges are completely flat. But if she had a little bubble here or here, that would be okay. Also, over the course of 10 days, you might see a little condensation under here. That is also okay. So she will leave this on for 10 days. She can shower with it, she can work out, she can go to the gym. It will stay in place for 10 days.